morning, everybody. Thank you first for the organizers of the very important DADA2 conference for giving me the chance to present a cohort of DADA2 patients in Germany. Obviously, I'm not the only author of this presentation because there are many physicians throughout Germany who are following these patients and providing care for these patients. I would like to acknowledge the help of all these colleagues for putting this presentation together. First of all, as probably many other cohorts of ADA2 deficient patients, I would like to report on the current age of our cohort, which you can see here. You see that we have patients who are just been diagnosed at the age of 2.5 months. All the way up to well into the 50s. So it's important to note that the ADA2 deficiency also is present and can be diagnosed in adults. As you know, we have a paper on this printed on the diagnostics of ADA2 deficiency in adult individuals. However, what's interesting that all of these diseases actually manifested in childhood or adolescence. So the oldest individual was diagnosed actually at age 23, having Pannatarrhitis nodosa. Now, 23 years later, she's aged age 56 and is doing quite well under anti-TNF treatment. But I think the important take-home message is that all these patients manifest within the first 2 decades of their life, and you have to catch them in the pediatric clinics to offer them the personalized treatment, which then allows them to hopefully become or live near to normal or a good quality of life. So how is that cohort of 26 patients structured? We have one patient who unfortunately died. However, she died prior to her diagnosis of ADA2 deficiency. She died at age 54. She had also Pannatarrhitis nodosa. She had a bone marrow failure, and she finally succumbed to infections, meningitis. 5 out of our 26 patients, which we pulled together, so that's 1/5 of the patients, have been transplanted. All of those 5 are alive. Roughly 40%, so 2/5 of the patients are on anti-TNF treatment, 12 of them on etanercept, and 4 of these patients on adalimumab. Most of these patients have responded very favorably to this anti-TNF treatment. However, 2 of the 16 only with partial response. Finally, I would like to point out that 4 out of the 26 patients are currently without an ADA2 specific treatment. So these are age 0, a very peculiar patient who has been born with a brain infarct. So we maybe want to discuss this patient later on. There's a 12-year-old, a 42-year-old, and a 47-year-old patient who I will present in detail in the remainder of this presentation. And we additionally know of another 2 adolescent patients, currently aged 12 and 15, who are currently not on a treatment. The first patient I want to point out is a 12-year-old female from Munich. She has a compound heterozygous mutations in ADA2. She is a compound, here you can see the compound heterozygous mutation leading to very much abolished enzyme activity. So we know that healthy individuals have roughly 80, and heterozygous individuals probably have an enzyme activity level of around 40. So this is very much reduced. However, in his first 12 years of life, there were no issues at all. The physical examination was normal, and he's currently asymptomatic and therefore not on any medication. I want to report on another, this time 42-year-old male with ADA2 deficiency. He again has a compound heterozygous mutation proven in ADA2. His enzyme activity is almost absent, and he did have a couple of phenotypic events which are very indicative of this disease. Splenomegaly since childhood, livedo reticularis, antibody deficiency, left-sided therm hyperesthesia in the years around the years 2000, which indicate a cerebral involvement. He also had an infarction of the crus cerebri in 2011. However, he did not have any cerebral events for the last 9 years, despite not being on anti-TNF treatment. His physical exam just last September, big guy, varicosis, eczema, hands, face, and buttocks. The spleen is a little bit enlarged. There are plantar warts, but completely normal neurology. We actually asked the insurance company to provide him the anti-TNF treatment. The insurance company declined, and we never made an effort to put him on anti-TNF treatment because currently he's doing well and he himself doesn't see the need of additional treatment other than the immunoglobulin replacement and the aspirin he's on. Another case is a 47-year-old female, and I'm presenting those cases because I want to make the point that adult cases with ADA2 deficiency without specific treatment, and that is without anti-TNF and without prior bone marrow transplantation, they do exist. They can live a fairly normal life. And for me, it's interesting to look at these cases to understand what these patients are doing right, what others don't do or don't have, to understand why this disease presents with such a variable expressivity. So this case does not have, or we didn't identify a mutation in ADA2. And here maybe you can help us with promoter mutations or mutations in intronic regions. But the enzyme activity was tested twice and was completely absent. Of course, until the genetic diagnosis has been confirmed, we have to put a question mark to this case. But her medical history is also very reminiscent of DATA2. Hashimoto thyroiditis, recurrent episcleritis, recurrent skin vasculitis, cerebral vasculitis with recurrent strokes, post-ischemic sequelae were slow speech, memory deficit, loss of peripheral vision, and a depression. Her physical exam this September, she still had the episcleritis and the neurological sequelae, and her current medication is 5 milligram prednisolone, but only when her vasculitis worsens. We would love to treat her with anti-TNF treatment, but currently the patient herself refuses to get this treatment. So this is a summary of our cases in Germany. I put Germany in brackets because the people who know Germany will realize that Innsbruck actually is not in Germany, but in Austria. So I would suggest for the upcoming talks to pull together the German-speaking countries and do one presentation on Germany, Austria, and Switzerland, because I'm sure also these other countries have additional patients. And I talked about those two adolescents in Graz, which is again in Austria, who are currently not on treatment despite being diagnosed with this disease. So I'm looking forward to your questions. Thank you.